أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين، أحمده وأستعينه وأستغفره ونعوذ بالله من شرور أنفسنا وسيئات أعمالنا وبعد. Hello to all my friends and to my colleagues and my fans and my students everywhere. This is Professor Dr. Tarek Ali speaking. Today I will speak about an important clinical issue, which is breast pain. To start with, we have to all know as medical practitioners or as healthcare professionals that breast problems are very common in clinical practice. And the commonest problems related to the breast, especially in females. And the most common problems or complaints or symptoms related to the breasts are breast pain, breast swelling or lumps, and nipple discharge. And number 4, changes in the skin of the breast. So breast pain is an important clinical symptom, and this is my topic today is about breast pain. Breast pain is very common in clinical practice and is commonly met with by medical practitioners in many of the female visitors or female cases which present to us in clinical practice. Pain in the breast, that is breast pain, يعني ألم في الثدي. The breast is an important anatomical structure and it is a sign of beauty especially in females. And the breast or the breasts, they are thoracic structures which is part of the chest anatomically. It is attached to the chest of the human being, whether male or female. But here I'm speaking more about the breasts in females. So the breast is an anatomical structure which is attached to the chest wall. And as we all know, they are attached to the fascia over the pectoralis muscles or the pectoralis major muscle, the pectoral fascia, by what we call the Cooper's ligaments, which attach the fascia overlying the chest wall or the pectoralis muscles to the subcutaneous tissue of the breast, the Cooper's ligaments or the ligaments of Cooper, which keep the breasts more or less firm and in a good shape and suspended to the chest wall in an anatomical manner, and they are responsible for whether the breasts are firm or pendulous or redundant breasts, the ligaments of Cooper. So the breast is part of the chest and they are attached to the chest wall. That's why breast pain or pain in the breasts أو الألم الثدي sometimes confused with other causes of chest pain. Other causes of chest pain being apparently related to, at least externally, to the chest. And the causes of chest pain might overlap with the causes of chest pain might overlap with the causes of breast pain, or we can say that causes of breast pain might overlap with causes of chest pain in some cases. That's why we will find that the breast pain should be considered in the context of chest pain. And other causes of chest pain might be considered among the differential diagnosis of causes of breast pain. But there are causes of breast pain which are due to problems in the breasts, that is intrinsic causes in the breasts, intrinsic causes of the breasts or mammary causes of breast pain. And there is another group of causes which we call it the extra mammary causes of breast pain, which is related to problems in the chest wall, namely in the chest muscles or in the ribs or in the ligaments or in the joints of the breast or in the nerves of the breasts. Because the most common chest causes which might overlap with breast pain is those related to the chest wall rather than those related to the internal structures or the inner structures of the chest, namely the cardiac causes or the non-cardiac causes in the lungs or in the pleura, which might also be considered among the other causes of chest pain, which may be confused with or overlap with causes of breast pain. Let me now start with talking about the mammary causes or the intrinsic causes of breast pain. يعني الأسباب الأشياء اللي ممكن تعمل or إيه الباثولوجي اللي ممكن يعمل اللي موجود في البريست which are intrinsic to the breast, which start in the breast, not in the extra mammary, not outside the chest, not outside the breast that is in the chest wall or inside the chest. The other anatomical internal structures inside the mediastinum or inside the chest, which might also cause chest pain and may be confused with breast pain. The mammary causes or the most common causes of breast pain in ladies, and this by instance, it accounts for about 70 to 75 or 77% of women, they come complaining of breast pain in some part of their life. That's why they are common. But in most of the cases, this breast pain is due to benign causes. And in most of the cases, they are temporary. And in most of the cases, they are cyclical or related to hormonal changes in the lady or in the body of that woman or that patient. So the causes of chest pain, number one is cyclical or hormonal. And this is the most common cause of breast pain. This is the most common cause of breast pain in women, is cyclical or hormonal changes related to changes in the menstrual cycle of ladies. That's why we find that breast pain is a common complaint premenstrual and is a part of the premenstrual syndrome in women, what we call the premenstrual syndrome in women. That is symptoms which women commonly complain of before their menstruation or before their blood shedding or vaginal bleeding starts. And this is called the premenstrual syndrome. Part of the premenstrual syndrome is breast pain. And this usually is in the form of heaviness or tenderness or swelling of the breast or the three together. That's the breast is swollen, somehow tender, and is heavy. That's why it's not a pain by definition. It is mostly discomfort or heavy chests. It is breast discomfort, because we all know that there is a terminologically difference between discomfort and pain. It is mostly a breast discomfort or heaviness, sense of heaviness in the breast, and swelling of the breast and tenderness of the breast. When the lady puts her fingers or her hand on her breast, she finds that it is tender. So there is pain and tenderness, there is discomfort and tenderness in both sides, and it is usually bilateral, affecting both breasts, to be differentiated from the non-cyclic causes of breast pain in women, especially in postmenopausal women, which is usually unilateral, affecting one breast, not the two breasts. So here in the cyclical or hormonal changes related to the menstrual cycle, it is affecting both breasts, the breasts on both sides, whether symmetrical or asymmetrical, and it is usually associated with tenderness and heaviness and swelling of the breasts. This is the premenstrual pain of the breast, being part of the premenstrual syndrome or the PMS in women. The breast pain due to cyclical hormonal changes, that is namely menstrual cycle. Then we come number two to non-cyclic pain, and this is as represented or as exemplified by the pain which happens in ladies also, especially postmenopausal women, and this might be related to cysts in the breasts or some other anatomical changes in the breasts, and they are usually unilateral, affecting one side of the breast, and they may be sharp or maybe stabbing pain or sharp pain. So here the character of pain is important. That's why, as any type of pain, we should fulfill the criteria of pain: the site of the pain, the character of the pain, the duration of the pain, the severity of the pain, other associated symptoms, exacerbating factors of pain, relieving factors of pain. This criteria of pain should also be fulfilled when a lady present to us presenting with breast pain. We should ask about all the classic clinical criteria which we ask about them in any type of pain in the human body. Again, the character, the site of pain, the character of pain, the severity of pain, the exacerbating factors, the relieving factors, associated factors, that is, what are the other associated symptoms, and whether there is any predisposing factors or not. For example, in the pain of premenstrual pain, which I mentioned it as the first cause of breast pain in women, it is relieved after menstruation. So it disappears after menstruation to come back and reappear in the next cycle before menstruation again. So this is relieving and exacerbation. So it's exacerbated by menstruation and relieved after menstruation. This is if it is cyclical or hormonal related to menstrual cycle. In the postmenopausal breast pain, it's different, and it's rather sharp or stabbing pain or fluctuating pain sometimes also. And it usually affects one breast, as I mentioned. And it may be related to some benign problems in the chest, like if the patient has some breast cysts or cystic disease of the breast, or may be related to the hormonal changes also, which happen at this time of life, postmenopausal. So this is the non-cyclic pain in the women presenting with chest pain, and this might also be related to hormonal changes also. So hormonal changes may be cyclical or non-cyclical. Also, among the other causes of chest pain, which we should consider, is the pain or discomfort related to anatomy of the breast. That is the pain or the discomfort which ladies with big breasts or macromastia or huge breasts, they might suffer from pain more commonly than ladies with normal sized breasts or small breasts. So ladies with big breasts or huge breasts, they might complain of breast pain more common due to anatomical or structural causes in the breast, which is heavy over the chest. So they come with discomfort, at least discomfort, we can call it discomfort, breast discomfort, or sometimes real pain in the breast. So this is due to breast structure. So it is here the chest discomfort or pain is more common in lady due to a structural or anatomical cause, namely the big breasts. So big-breasted women are liable to have breast pain or breast discomfort more frequently than ladies with normal-sized breasts. Another cause, or number 4, is ladies wearing improperly fitting bras. That is, the breast dress which they wear is not properly fitting to their breasts, so they cause also problems related to breast structure and anatomy. So improperly fitting bras in ladies اللي هم الستات اللي بيلبسوا سوتيانات أو حاملات ثدي مش ليست في مقاسهم او مش في حجم مقاس صدرهم، ايضا ممكن يجوا يشتكوا من بريست بين. وهنا لازم اول حاجه في التريتمنت ان احنا نصلح and ask the lady to wear the proper breast bra size, the best size هنا, because here the pain is due to problems in structure of the breast and in the anatomy and in the position of the breasts in relation to her chest wall. So she might be, and that related to body weight and breast weight and its relation to the weight of the patient and the weight of her chest wall. So it might, this proportion between the breast weight and the chest weight might cause discomfort or pain in the breast. So improperly fitting bras. Another cause, or number 5 causes of chest pain, might be also related to previous injury to the breasts or to the chest or previous surgery. That is, ladies, for example, which might have previous breast surgery, they might come complaining of breast pain. So previous breast surgery or previous breast injury or previous breast trauma might be a cause of breast pain. So we should ask about these things in the history of the patient. So this is also another cause of chest pain. Another cause of chest pain in women, or breast pain in women, is medications. And the most common medications causing breast pain اللي بتخلي الستات تيجي تشتكي من ألم في ثديها هو contraceptive pills. So we should ask about contraceptive pills, that is oral hormonal contraception. So most, if not all, the oral hormonal contraceptives, or even the other systemic contraceptives, especially the injectable contraceptives, they might also cause breast pain. So we should ask about hormonal contraception, whether oral or non-oral, injectable. They also might cause chest pain. Other drugs which might cause breast pain, in women, other drugs are the hormone replacement therapy. Also, the infertility medications might cause breast pain in women, the infertility medications. So we should ask about this. Hormone replacement medications, which we use them. Also, in ladies, might also cause, especially those which are used in menopausal women as a sort of estrogen replacement. They might cause pain in their breasts if they are using hormone replacement therapy. Also, some antidepressant medications, that is psychotropic drugs, which we use them in treatment of diseases, psychic diseases, or psychiatric disorders like depression, they might cause pain in the breast. So breast pain might be related to medications, especially hormonal contraceptives and antidepressants and hormone replacement therapies and infertility medications, which we use them in cases of infertility. So these are drug-induced breast pain. Other causes of breast pain also might be related to lifestyle of the patients. That is, women or ladies consuming too much coffee and too much caffeine containing drinks, they might experience breast pain. So they, among the therapeutic approaches in these patients, should ask them to modify their lifestyle and avoid drinking caffeine. Also, too much drinking of alcohol, they might cause breast pain, so alcohol consumers. And as I mentioned, those who are addicting drugs, drug addiction or substance abuse, they might cause breast pain. So the things related to lifestyle, like as I mentioned, the caffeine and the alcohol, they might cause, and we have to ask the patient to cease using these substances or drugs or drinks in order to get relief of her breast pain or breast discomfort. So lifestyle changes might also be one of the causes. Also, neurogenic and psychogenic causes might be cause of breast pain, like patients with severe stress or patients suffering from severe anxiety neurosis or patients with depression. So psychic diseases might cause also breast pain or breast discomfort, and we should ask the patient about any psychological disorders or any psychic problems or any stress or any anxiety or depression. They might all cause breast pain. And then we come to the last cause, which is the rarest cause of breast pain, and which are the people waiting for, is or can neoplasms cause breast pain. يعني هل الأورام breast neoplasm can cause chest pain? This is rare, especially, of course, in the mind of people, cancer. And if it is neoplastic in origin, the chest pain, it's most of the cases, it is related to benign chest neoplasm. That is fibrocystic disease of the breast, for example, or a cystic neoplastic disease of the breast, especially if the cyst experiences bleeding inside this cyst or some form of degeneration or necrosis and bleeding and swell suddenly, it might cause breast pain or breast discomfort. So cystic diseases and cystic changes in neoplastic disorders of benign neoplastic disease of the breast might be among the causes of breast pain. Then rarely and lastly, if it is malignant, because malignancy is in the breast is usually painless. It is not painful unless it is of the highly aggressive type of breast malignancy, which we call it inflammatory malignancy of the breast, which is mostly acute and associated with some inflammatory symptoms, breast redness, tenderness, and increasing size of breast lump or progressing breast lump. This is called inflammatory malignancy of the breast, and this is very, very rare among the breast neoplasms or among neoplastic breast problems or among neoplastic causes of breast pain. So the pain in the breasts, عشان أطمن الجميع، ألم الثدي في الستات ليس له علاقة بالكانسر أو الكانسر breast. The cancer in the breast usually present with painless lump. It is usually painless lump يعني في كلكيعة في البريست. وهنا الكوكيعة دي لازم ايه تتفحص لوحدها. فهنا ال commonest symptom of breast cancer is not breast pain, it is breast lump. And here, our breast swelling. And here, that's why any patient with breast pain, we should examine for the presence of breast lumps. And among the red flags or red flag symptoms and signs in patients with breast pain is if the breast pain is persistent, if the breast pain is severe, if the breast pain is persistent for more than 2 weeks, and if the breast pain is very localized and to an area of the breast and doesn't want to disappear. هنا دي لازم على طول نروح ايه نسيك medical attention or medical advice or medical examination or medical evaluation. لو البريست pain ايه هي when we seek medical attention in patients with breast pain? If the pain is persistent, if the pain is sharp, if it's sharp and severe, if the pain is localized to a specific area of the breast, and if the pain is associated with breast lump, and if the pain is associated with breast discharge. That is nipple discharge. Whether discharge is serous discharge or bloody discharge or otherwise, or milky even. Because nipple discharge is another symptom of breast disease. And most common, يعني في discharge بيخرج، في سائل بيخرج من الحلمة of the breast. This is called nipple discharge. And this is another symptom of breast disease. And the most common is serous or milky or bloody or mix of serous and bloody discharge from the breast or other types of nipple discharge. So if the breast pain is associated with nipple discharge or with a breast lump that is swelling, or it is persistent, or it is severe, or it is very localized and doesn't want to disappear, and if associated with changes in the skin of the breasts, that is the skin of the breast is red or is swollen or is very tender or show some type of rash or reticulations over the skin of the breasts, we should ask for we should go and seek for medical advice or for medical evaluation. This is when or what are the symptoms and signs which the patient, if they are present, should immediately go for medical evaluation and to seek medical advice. That is, need medical attention for further evaluation and for further management of the breast pain. So this is the breast pain. It is common, but in most of the cases it is benign, and it's very, very rarely related to breast cancer, and it's mostly related to hormonal or cyclical changes in women. But if there is breast lump or nipple discharge or changes in the skin of the nipple or other systemic symptoms or organ system symptoms, we should immediately go for checking up and for medical evaluation, and immediately the patient should seek medical attention. Thank you so much, Professor Dr. Tarek Ali.